G'day boys, and welcome to this next STEM, which deals with a growing and ageing population and what impact that population has on various things. So you can see up here at the top of the screen is the actual dot point, and it literally is called a growing and ageing population. There's 4 subheadings underneath it, which we will look at as we progress through this presentation. But the important thing is that you understand what these things mean, but you need to be able to look over here to the Learn To. You need to be able to assess the impact of this growing and ageing population on these 4 areas, and we also look at this in the presentation as well. Firstly, before we actually get into any of this information, let's just have a look at our changing population structure, which is very well represented by this graph. You can see here in the green, which is the lighter colour through the middle, that represents Australia's population in 1956, and the purple is Australia's population 50 years later in 2006. And it's pretty obvious to see that from the ages of 35 upwards, we have significantly more people in the population. So not only is our population getting bigger, but the amount of people in the upper parts of the population, so around here where I'm circling, is increasing. If you scan down and have a look at the younger age groups, particularly your demographic here, 15 to 19 year olds, that's pretty much stayed stagnant over the last 50 years. But if we go down further, you'll see that there were significantly more people aged 14 and under in 1956, represented by this the green marking there, as opposed to now, which is represented by the purple. So overall, yes, our population has increased, but the concern and the impact, or the reason there is an impact on the health services, the reason we're looking at it in this core, is because there's a huge increase in population in this area, okay, and particularly in the 65 and up area. And naturally, these are the people that are going to be making or utilising the most health services. They're going to need the most health care, so obviously that's going to have a fair impact on these areas up here in the dot point. Just moving on to the next slide, you'll see this is the general sort of demographic. The population rate is growing about 1.5%, but you can see the age structure of the population is increasing. That's the most concerning bit. We can probably sustain a growth of 1.5% in the population, but the problem is that the population is getting older, so the age structure is changing. Okay, so you can see here that people aged up to 14 years in that 50-year period grew by about 46%, as opposed to the proportion of people aged 65 and over, which grew more than 200%. And you can see what happened to those aged 85 and over. It grew by 7 times, which is a massive, massive margin. And also you can see here that the percentage of people aged over 65 years has gone over to 13%. Which is, they're saying that clearly depicts an ageing population. And if you think about it, these 13% of people are the ones using the vast majority of health services. It wouldn't be a problem if people aged 65 years and over used 13% of the health services and facilities, but they don't. They use significantly more. And as the number of people aged 65 years and over increases, thus, so does the increase for demand on health services and health service workers, which is what we're going to look at now. So just addressing the actual learn about dot point, part of the dot point, a growing and ageing population. First off, we look at healthy ageing. Now, ideally, we would like our population to age healthily, because this will take pressure off our medical services and also our medical workforce. So when we look here at what healthy ageing actually is, you can actually read that. But however, unfortunately, we're not aging, or our population is not aging necessarily very healthily. And this is in fact due to a lot of risk factors that the current 65 years and over people undertook in their youth and through their midlife and so on, which is now starting to catch up with them. So and you can read here that the actual monetary burden, which is the economic thing, and the medical burden created by illness and disease amongst these elderly people is putting immense pressure on the Australian health system at the moment. So in a perfect world, our people grow older healthily, but that's not realistically what's happening, which leads into the next sub-dot point, and it's the fact that we have an increased population living with chronic disease and disability. And if you have more people living with disease and disability, then they need more care. So it stands to reason to say if our population is getting older, then they are going to have more of these conditions that require care, so therefore that is going to put immense strain on the health system. You can see here this is sort of what strategies governments are implementing to try and address these issues, and they're the particular areas that they're looking at, specifically in relation to elderly people, because these conditions, as it says here, are placing such a huge burden on the healthcare system. The demand for health services and workforce shortages. And you can see here, as our population gets older and gets bigger, there's going to be an increased demand for health services, and as a result, there's going to be a decent amount of workforce shortages. So you can see down the bottom here, key point, currently supply is not able to satisfy demand. There's a number of reasons for this, which we look into later, but some of the reasons are people just don't see it as an economically viable job to be a nurse or to be a carer for someone. There's not enough university graduates coming out into the workforce to fill in the spots taken or freed up by those who have retired, and a number of the clinical staff are part of the actual population that is getting older, so they're retiring. So that's just a couple of reasons why the demand has increased, but there's actually a workforce shortage in the area of health services. And the last sub-dot point, the availability of carers and volunteers. So obviously we can see here that there's going to be an increase in demand for aged care. That stands to reason. As the more people there are that are older, that means there's going to be more people that demand or have a demand for aged care. But the problem is the informal workforce will not be able to meet this increased demand. So there's going to be a gap there. Just like we mentioned in the previous one, there's going to be a gap in health workers and professionals. There's going to be a shortage in the supply of carers and volunteers, unfortunately. So they're the four sub-points in the Learn To. Now we look across at the Learn About, which assesses the impact of this growing and ageing population specifically on four areas. The first one is, what is the impact on the health system and health services? Now this is a bit of a wordy slide, but the impact, obviously, there's going to be a significant impact. Like there's more demand for health services, so therefore the health system is going to be put under enormous pressure, and that is a massive issue with any government that is reigning at the moment, because there's just not enough money to go around and not enough staff, not enough facilities to adequately service our population. And part of that is due to the fact that the population is getting bigger, but it's also getting older. And you can read through that at your own leisure. The second impact that we need to assess is that on the health service workforce. And as we've mentioned before, the more the population gets older, the more health professionals are going to need to care for them. Now, as we've mentioned here, the actual number of people in the health service workforce are decreasing. And I've just outlined three reasons here. There's a lot more than just those three, but you can read through those three reasons. But so the impact, when we assess the impact on the health service workforce, it's actually creating a shortfall in people working in the health service workforce, because demand is significantly increasing, whereas the number of people in the workforce, whilst increasing, is not increasing anywhere near at the same rate as the demand. So therefore there's a big problem. The impact of the growing ageing population on the carers of the elderly. You can see here that because the number of elderly people increases, you're going to put an increased workload on those that care for them, because, as I just mentioned, the number of elderly people is increasing significantly, but the number of people caring for the elderly is not increasing. If in fact it may actually be decreasing. and there's a graph you can refer to in your textbook which actually shows that as we head through the next 30 years or so, 30, 40 years, the ratio of carers to the elderly people is actually decreasing at a reasonably significant rate. So obviously if there's a bigger workload on the people, that's going to put more stress and pressure on them. And people are more likely to leave to seek other employment because they would look at it, I'm under a lot of pressure, under a lot of stress, I'm not getting paid that much, so why would I want to stay in this job? And then you add in number 3.3 here, the same reasons that are affecting the health service workforce are affecting the carers of the elderly. So the proportion, the increase in people working in this area is not going up at the same rate as the increase of people who need the care. The last area that we assess the impact of the growing and ageing population on is that of the volunteers. Now it's been projected that volunteers will not be able to meet the increased demand for care, and so there's going to be a gap in the supply of volunteer care as well. So again, it's just all going down the same path of the growing and ageing population is increasing significantly, but the actual workforce or people available to care for these people or for this growing and ageing population is not increasing at anywhere near the same rate. So therefore, as we see here, the volunteer workforce is not going to be able to keep up with the demand. Supply is getting away from demand, or demand is well away from supply, so there's a shortage of people. So that's across the board. So it's fair to say that when we look at the impact of the growing and ageing population, it's not having a positive impact. It's creating more strain on health services and facilities. It's creating more strain on the health professionals. It's creating more strain on the carers of the elderly and also the volunteers. And that pretty much sums up that dot point. Thank you for your time, men.